1 in 2 heart attacks and strokes are linked to high blood pressure. Many pharmacies offer a blood pressure monitoring service where you can come in and get your blood pressure monitored in the pharmacy. Most people with high blood pressure, or hypertension as it's called, have no symptoms. It's therefore important that you do check your blood pressure on a regular basis. At this moment in time, the recommendation is that anyone over the age of 40 would check their blood pressure at least once every 5 years. So it's not something you need to do on a daily basis, but it's important that you do it on a regular basis. When you get your blood pressure reading, it will have 2 numbers there. There will be the systolic, which is the upper reading, and the diastolic reading, which is the lower number in your blood pressure reading. The top reading will give you an indication of the force that your heart is pumping with, and the lower reading is the resistance in the blood vessels as the blood is pumped through them. So once you have your blood pressure reading, a reading of 140/90 or above would generally be considered high blood pressure. Obviously, if you suffer from other conditions such as diabetes, that may affect how those results are interpreted. But that's something that you can obviously speak to your pharmacist about or speak to your GP about to get some more advice. So once you have your blood pressure reading, you can speak to your pharmacist and have that looked at. Obviously, it will depend on other conditions and other factors as to what you do next. If your blood pressure is high, then a recommendation might be made that you would visit your GP. If you're already taking medication for high blood pressure, it's very important that you continue to take that on a regular basis. You don't stop taking it unless your GP advises you to do that. As I've said earlier, most people with high blood pressure don't have symptoms. So it's important, therefore, whether you're feeling well, bad, somewhere in between, that you continue to take your medication as prescribed.